this juncture there. Back to McIlroy. You practice something called functional medicine.
Yeah.
So how does cannabis therapeutics fit in? What is functional medicine and how does cannabis therapeutics fit in?
Sure, and Dr. Knox actually gave a good definition of it yesterday. It's basically looking at the root cause and kind of going upstream to fix downstream problems, right? So a lot of the chronic degenerative diseases that we have in the U.S., diabetes being one of them, is there are ways that we can start at a foundational level, looking at nutrition, looking at other things that can really help play with the endocannabinoid system, acupuncture, osteopathic manipulation, certainly herbs and supplements, and then using cannabis, which is a beautiful and extremely potent herbal, therapeutic, but not a panacea. And so I think that we're seeing how strong and effective it can be, but really, I studied Chinese medicine on a master's level before I went to medical school, and it's in Materia Medica from 2,000 years ago, not in the flowering form. It was more of the seeds and the roots, but this has been something that's been around for a long time, but always in a formula, right? This is really the first time cannabis, at least outside of the Eastern perspective, Ayurveda and Chinese medicine are always looking at how do we craft a formula. And so I think, trying to work with that, acknowledging the terpenes and how the profile is coming together, but then also some other herbs and supplements, curcumin, which is from turmeric, right, which is a really potent anti-inflammatory, and how that can then weigh in with cannabis and cancer, and those play very well together. I work a lot with medicinal mushrooms like turkey tail, Trametes versicolor, also has some very strong anti-cancer effects that I think work synergistically, not necessarily in a specific formula, but with cannabis as part of an overall protocol. And so that's a lot of what I do, is utilizing cannabis as a primary driver, but then bringing in whether acupuncture treatments, osteopathic stuff, but then also a lot with other herbs and supplements. And really, I also am, the psychedelic renaissance, as you know, and have been a big part of, is happening right now too. And so I work with ketamine for treatment-resistant depression and other mood diagnoses, and I think the way that cannabis also can play with that, right? I mean, there's a way that if you have a little bit of cannabis with that ketamine, that changes the reaction and increases the potency of ketamine. So I think we're at this, the dawn of so many things that are coming out. We finally have recognized that cannabis is not just about treating symptoms, right? We really can get to more of the root cause of a lot of pathologies, but then what are other agents and adjuncts that we can use to create a better entourage effect, I think, overall. That's a lot of help.
I want to follow up on one of the things that you pointed out about cannabis being, or hemp being part of Chinese medicine for thousands of years. And in terms of when you study Chinese medicine recently, what role, if any, how does it figure in?
No, that's a good question. So I went to school in the late '90s. It didn't, right? We had it in the herb pharmacy. It was, but that was the hemp seed, right? It was the seed only. And I don't think, because they weren't really using the flower, they used it a little bit more in North India as part of Ayurveda, but it was really, it was for constipation. Like, that was, if you look up the Chinese Materia Medica, the number one indication for cannabis sativa is as a oil that you're getting from the seeds. And so it was a little bit different. But, when you look at Chinese formulas, they often are, range to 6 to 8 ingredients would be a common number. And you have, a primary driver, a chief herb, and I think cannabis, any formula that you're going to put in it, it's going to be the chief herb, right? But then what can we add to that to again, sort of increase or elevate the entourage and the efficacy of the overall
I like to say that the endocannabinoid system validates plant medicine. Right? I think that's the reason why it was suppressed for so long, that we weren't taught that. Because it would force a departure from the conventional system as we know it. But beyond cannabis, which is maybe the most versatile plant that works on the system, we're speaking to botanical synergy. Right? We're learning more and more about these botanicals that have been used since really the beginning of time, and how we now can create formulations with cannabinoids as the primary, or the primary leading molecules, if you will, to create really